This is Tony Preston. Today's presentation is about the integrative model. First, let's talk a little bit about the idea of a holistic approach. Holistic approaches are characterized by the idea that we see the person as a whole. It means that the parts are related and that they interact with each other. Moreover, it says that there's a best component that you should address to deal with the overall problem. So let's look at this diagram of the holistic idea. If we focus on the green triangle, we can see that mind, structure, and biochemistry are related to each other. Any counselor could tell you that they can change structure and biochemistry. They will tell you that structurally there are postures of anger and postures of depression. They'll also tell you that the depressed person has an affected immune system, and so there's biochemistry that's affected by what happens in the mind. Any pharmacologist or nutritionist will also tell you that they can affect structure and the mind. Any pharmacologist will tell you that they can give you chemicals that will change your serotonin reuptake inhibitors and make you feel different and have a different attitude. So they'll also tell you that chemical problems like calcium deficiency or protein deficiencies will affect your structure. Likewise, any structural therapist will tell you that they can affect your mind and your biochemistry. Any structural therapist will tell you that relaxation and pain relief gives people a better attitude. They'll also tell you that better circulation and a relaxed attitude also changes your biochemistry. So the holistic approach is really about understanding that the pieces are related, that they can be addressed in more than one way, and that there probably is a most effective way to deal with it. Okay, let's move from holistic to integrative. Let's talk about the word integrative. Integrative is an adjective. It means that we're intending to unify things that are separated. We're doing something that causes integration. Let's contrast that against integrated. Integrated techniques or integrated approaches say that we have things that work well together. For instance, hot stones work well with relaxation work, or stretching works well with neuromuscular. So these techniques integrate well together. That's different from integrative. Integrative suggests that we have a pattern with governing and ancillary components. Let me take an analogy. I have this old house, and one day the door in the bathroom started squeaking, and I oiled them, and the latch wasn't closing, and so I adjusted it. Some time passed, and those problems returned, and I went to the basement, and I found a post that was rotting. I jacked up the house, put a support underneath there, and it fixed the door. I didn't have to deal with the door anymore. So the post in the basement was a governing component. Once I changed it, the other components, which will deteriorate, were fixed. It changed their progression and tendency to deteriorate, and even reversed the problem some. Bodies are like that. We can have a pattern with governing and ancillary components. This is not a new idea. Mostly we see this in body work by dealing with nerve entrapment and nerve compression. We know that a muscle or some part of the body will fail to do well if there's nerve pressure. And so we have a simple idea of if we will go through and relieve that nerve pressure or compression, then the muscle will return to its normal function. There are lots of ways to look at this in body work. Some of the patterns are more complicated and some are more simple. So let's take an example. I had a client who came in last year. They had a problem in their neck. They were having some compression in their lower cervicals. I happened to work with a very talented upper cervical chiropractor. I had spoken to him about this problem many times, and one time he pulled out a collection of 40 cases where he adjusted the atlas very precisely, and it fixed the lower cervical problem. So I knew that I could not, in my work, set an atlas precisely, and so I sent the client to the chiropractor. The chiropractor adjusted him and his nerve compression, and the burning and electric shock feeling down his arms went away. Let's talk about a more complicated example. The Peroneus Longus is a lateral low leg muscle. It has a trigger point, that creates weakness and pain on the outside of the ankle. People often suffer from a lateral sprain because they stepped off a curb when this trigger point is weakening the muscle. If you go for foot massage, you'll probably know that on the bottom of your foot, there's a very tender point. Just right there in your arch medially, just right behind the ball of your foot, there's a knot there, and it's usually a little bigger and a little worse on the right foot. This is the attachment of the Peroneus Longus muscle. We can mobilize the fibular head by the technique shown in this illustration. It's a gentle hold, usually within somewhere between 30 and 90 seconds. The fibular head shifts a little bit, the knot in the bottom of the foot goes away, and the trigger point on the side of the low leg goes away. So it tells me that I can change trigger points in muscles by working their local joints. I've discovered a governor and an ancillary component. The joint that the muscle crosses is governing the trigger point in the muscle. This process becomes quite self-evident once you begin to play with it. Okay, let's take this a step further. That binding in the fibular head is created by a posterior shear in the pelvis. I can release the shearing in the pelvis on that side, and the fibular head will shift, the joint between the tibia and fibula will shift, and the trigger point in the Peroneus Longus will go away, and the big tender spot on the bottom of the foot will release. I can take this a little further. If I go to the cranium, I can actually release what's called a lateral strain pattern of the SBS, and it will shift the pelvis. That will shift the tibiofibular joint. That will release the trigger point in the Peroneus Longus, and the big knot on the bottom of the foot goes away. Again, this is fairly self-evident. You can see immediately after the technique that the Peroneus Longus has better tone and that the knot in the bottom of the foot is gone. This is a great example of an integrative pattern. The cranial pattern of the lateral strain governs the hip, the tibiofibular joint, and the Peroneus Longus. It governs a number of other things, but in this particular pattern, it seems to be the highest governor. Now, it doesn't mean that I can't go through and do some traditional neuromuscular techniques. I could go through and work that lateral low leg, do a little bit of ankle decompression, do the foot routine, and likely that trigger point will improve and the function of the leg will improve. However, it still has a tendency to return because of the governing piece in the cranium and the governing piece in the pelvis. Again, we see patterns with governing and ancillary components. Even though integrated techniques may have things that work well together, for instance, maybe I worked this with the neuromuscular routine and then afterwards did some stretching or did some icing of the ankle, integrative techniques create the components of underlying patterns. More symptomatic approaches, even though they may be well integrated, tend to fix problems closer to the symptom. Integrative approaches focus on fixing problems that govern those symptomatic components. This creates a body that's better at self-correcting, and that's the point here. It's not just that we want to fix the ankle, we'd like to change the body so that its tendency to recreate that problem goes away and it becomes better at self-correcting. There's more about this on the site. You can find my content on integrativeworks.com. If you're watching this on YouTube, hit the like and subscribe button. Thanks for listening.